Welcome, dear friends, colleagues, and viewers, cardiologists and students alike. This is Dr. Jaitly on your source of learning, MuniMeterHealth, where we teach cardiology and, of course, human heart illnesses and awareness. So primarily, we offer short videos and chapters where one can learn. Today, we're going to be talking about what is the role of digoxin. Now, that's a very old drug, specifically in setting of atrial fibrillation. What is the role now? So for decades, we know digoxin has been around, and in fact, it is originally from the digitalis alkaloid, and so it was basically a plant product. So as a result, that was refined, and digoxin, or lanoxin as it's sold as, has been around for a long time. Now, many patients on baseline digoxin, the study from JACC recently only reported, Journal of American College of Cardiology. They studied more than thousands of patients, and they inferred that baseline patients who were already on digoxin, so baseline patients who were already on digoxin, they did not, the mortality was not affected in those patients. Very interesting. However, the moment the levels started, the serum digoxin levels, they started rising, if you will, and we are talking about 0.5 nanograms per ml. The increment was the mortality started to increase. So sudden deaths were higher as the levels rose. Very importantly, if the levels are more than 1.2 nanograms per ml, remember that this is nanograms per ml, the moment the serum digoxin level was more than 1.2 and above, the hazard ratio was twice, more than 2, in those individuals where patients' levels were higher, and as a result, the mortality had almost doubled to quadrupled. So it was 2x to 4x. So what is implying is digoxin is not a safe drug. It is certainly way down, if at all, in the armamentarium to treat atrial fibrillation, folks. It's been around for a long time. A baseline digoxin that was already in place, especially in, you say, older patients who were taking it for long chronic years, their mortality was not affected as long as the levels were in the therapeutic range. However, in newer initiations, now that's another important thing. Anybody who initiated digoxin at that level was again prone for higher mortality. So the mortality was again higher in those patients who were newly started on digoxin. So these were the new cases. So, the study in a nutshell really tells you that, look, first of all, do not initiate digoxin in a setting of AF, regardless whether the patient has heart failure or no heart failure. Okay. 2, the levels higher than 1.2 nanograms per ml, they were associated with higher mortality. And 3, as the serum digoxin level rose by 0.5 nanograms per ml, their mortality was again was higher. So essentially, we are looking at some of the conclusions out of this trial, which was published in the JACC, and I think it's very important that the students, the residents, the fellows, and especially the MD postgraduate students, I think it's worth noting that because they will be ultimately carrying on the baton in cardiology, digoxin should not be initiated in a setting of atrial fibrillation. It's way, way down in the list, and perhaps not even in my list, at least. So anyway, so that was my opinion on this short video chapter on the role of digoxin in atrial fibrillation. Hope you enjoyed it. Do press the like button if you like our short chapters, and stay tuned for more new exciting stuff coming from the trials, the studies that we normally read upon, and then of course present to you in a very, very short, quick fashion. Stay tuned on MuniMeterHealth, your source of learning cardiology.